Few days ago, a case study related to cardiology. There was a case that a 64-year-old man who was diabetic and he was hypertensive and he was complaining few months ago SOB. But when uh, we accidentally develops severe SOB and chest pain. The pain was characterized by sharp and breathing. The pain was increased by breathing. As he inhaled, as he inhaled uh, air, so the pain was increased by this. And when he was sitting forward or leaning forward, the pain was relieved. So I asked that there were few options: MI, pericarditis, and some of other options, but the right option was pericarditis. These symptoms represent pericarditis. How? What is pericarditis? Let's discuss. You know, heart is composed of basically one layer is called pericardium, second layer is called myocardium, and the third layer is called endocardium. Okay. Pericardium is further divided into two layers. One is called fibrous pericardium, fibrous pericardium, and the second one is called serous pericardium. And the serous pericardium is further divided into two layers. The outer layer is parietal pericardiums, and the inner layer is visceral pericardium. Visceral pericardium. Okay. As you see here, pericardium. This is outer layer. This is heart. This is a sac, and in the sac there is lying heart. This is outer layer that is adherent to diaphragm. Okay. This layer is called fibrous layer, as I discussed. In these two layers, parietal layer and serous layer. These are two layers of the serous layer. It means that serous layer is further divided into two. Outer is parietal, that is continuous with fibrous layer, and the innermost is visceral pericardium. In between these two layers, parietal pericardium, parietal layer, and visceral layer, there is fluid. These are fluid. As you see here, the fluid is called serous fluid. And there are some cells called flattened squamous cells, and these cells released and produces these fluid called serous fluid. So when the pericardium is inflamed, there is also accumulated fluid in these two in between these two layers, parietal layer and visceral layer. So the fluid accumulation produces pressure and the heart. That is, after it radiates to somehow to the left arm, but often it is like a pressure like a pen, sharp pen, stabbing pen. So, what is the pathophysiology of the pericarditis? First of all, we should discuss the causes of the pericarditis. Pericarditis can be caused by virus. It can be viral. Most of the common viral viruses that causes pericarditis, cocci virus and ecovirus and influenza virus. These are common viruses that causes pericarditis. And bacteria, if you see bacteria, it is less common caused by bacteria than virus. And bacteria like tuberculosis, it can be due to tuberculosis, Mycobacterium tuberculosis. And those bacteria particularly that produces pus, these are the causative agents that causes pericarditis. And it can be due to trauma. During accident, it can be hit by trauma, hit by someone else, something else, or directly by trauma, and there is inflammation of the pericardium. So the inflammation of the pericardium is called pericarditis. Let's come to the pathophysiology of the pericarditis. First of all, there is inflammatory response, and if inflammatory response, there are some mediators, inflammatory mediators are released, like cytokines. Some cells that release cytokines, interleukin 1 and interleukin 6, these are also released. And there are tumor nucleus factor like alpha is released, which increases vasodilation in the pericardium. After that, it attracts some immune cells. After that, immune cells like neutrophils, macrophages, that damage the tissues, fibrous tissues, and the parietal layer and also the visceral layer. It damage these layers, and as a result, there is inflammation which we call it pericarditis, and there is the fluid in between these two layers. As I discussed, that here is the pressure increased by the accumulation of fluid. So the accumulation of fluid is called pericardial effusion. Okay, in the next video, inshallah, we will discuss the treatment of pericarditis. Thank you very much.